A new approach to home care, relieving stiffness after a stroke, transforming your home into the optimal rehabilitation space with the hand jiggling approach.
You may not know hand jiggling therapy. This is the new therapy for the one who is suffering from after-stroke syndrome. Rehabilitation after a stroke is a truly long journey, both for the patients and their supporting families. Facing hands and arms that won't move as desired, day after day. But what if there was a new, more comfortable and effective way to support this journey right at home? Today, we will introduce exactly that. Many stroke survivors suffer from spasticity, severe muscle stiffness. Muscles become tense and rigid, hands clench tightly, and elbows remain bent. This makes daily activities like changing clothes or eating extremely difficult and often causes chronic pain. After being discharged, many face the wall of rehabilitation. In the hospital, specialists provided daily training, but at home, the volume of training inevitably drops. Muscles stiffen further, movement becomes harder, and a negative cycle begins. The biggest cause is clear: an overwhelming lack of training volume. Outpatient rehab simply takes too much time and physical energy to do every single day.
But what if you could achieve an overwhelming amount of training at home without having to grit your teeth and struggle? To overcome this wall, a new approach was born: effortless home training. The star of this method is hand jiggling. This was carefully developed by rehabilitation medicine specialists to ensure effective training can be continued easily at home. The most amazing feature of this device is while training. You can use it while watching TV or while chatting with your family. Instead of setting aside special, strenuous time for rehab, it seamlessly blends into your everyday life.
Why does simple rhythmic jiggling work so well? There are 4 key effects. First, rhythmic vibration gently relieves severe muscle stiffness. Second, the machine gently moves joints that are hard to move on your own, maintaining their flexibility. Third, this regular, correct stimulation re-educates the brain, reminding it of proper movement. Fourth, and most importantly, it's a passive movement. Because you don't get tired, you can keep doing it. Let's look at the result of medical research to understand why hand jiggling is effective. In the study, patients with stroke sequelae were divided into 2 groups. One group that performed hand jiggling and the other group that did not perform hand jiggling, and their progress was observed. Does it really work? Yes. A highly reliable clinical study conducted across 5 hospitals in Japan with 93 stroke patients proved it. The group that added hand jiggling at home to their standard therapy showed significantly greater improvement in arm and hand function. Furthermore, it statistically reduced chronic pain, with no serious side effects reported. It is a scientifically proven, safe approach. So, how do we incorporate this into daily life? Hand jiggling isn't a replacement for outpatient rehab. It is the ultimate partner. It provides the crucial, daily, repetitive practice that outpatient care can't fully cover. Using it is incredibly simple. Just rest your arm on the device, relax, and let the machine do the rest. How long for one set of training? It's just 5 to 10 minutes for one session. A few times a day, for example, morning, evening, or during TV commercials. No matter how long it has been since the stroke, it is never too late. By consistently continuing the right approach, there is always the potential to regain function. Combining professional medical and rehabilitation treatment with home training using hand jiggling creates the greatest synergistic effect. If your current rehab isn't progressing, it's not because you aren't trying hard enough. Your brain simply needs more repetitions of the right movement. Hand jiggling might just be the missing piece to provide that new hope.